Hello everyone, my name is Ricky, and today I will be presenting on the disease malaria. In this presentation, I will explain what malaria is, the parasite that causes it, how it's transmitted, how it affects the body, symptoms, diagnosis, treatment and prevention, and also talk about its impact around the world. So what is malaria? Malaria is a life-threatening infectious disease caused by parasites from the genus Plasmodium. It is spread through the bite of an infected female Anopheles mosquito. Um, Malaria is most common in tropical and subtropical regions because warm temperatures and standing water provide ideal breeding conditions for mosquitoes. You can see on the map here the number of new malaria cases that occur throughout much of the sub-Saharan African region. Although malaria is preventable, it still affects hundreds of millions of people every year, um, primarily in Africa. Next up, I'm going to talk about the pathogen. The pathogen is Plasmodium. Um, the parasites are classified in the kingdom Protista. There's 5 Plasmodium species that are known to infect humans. Plasmodium falciparum is the most dangerous. It's responsible for the majority of malaria-related deaths because it can rapidly infect large numbers of red blood cells and lead to severe complications. You can see the microscopic image here demonstrates Plasmodium parasites inside infected red blood cells. So this is something that physicians and healthcare workers would see when diagnosing somebody with malaria. So next up, I'm going to talk about transmission. So as I mentioned earlier, it's transmitted through the bite of an infected female Anopheles mosquito. A mosquito becomes infected after feeding on somebody who already has malaria. So when that mosquito bites another person, it injects the parasite into their bloodstream. So that's how it gets transmitted. The parasite then travels to the liver where they begin to multiply, and that's when they go to enter the red blood cells, and that is what causes illness. It's also very important to know malaria does not spread through casual person to person contact, so coughing, shaking somebody's hand, sharing food, that's not going to transmit malaria. Because transmission depends solely on mosquitoes and humans, controlling mosquito populations is one of the most effective ways to reduce malaria. Next up, the malaria life cycle. The diagram to the right there illustrates the complete life cycle of the malaria parasite. It begins when an infected mosquito injects sporozoites into the bloodstream during a bite. These parasites then travel to the liver, and that's where they mature and multiply, and then enter the red blood cells and cause symptoms. Some parasites develop into a form called gametocytes, and that's when another mosquito bites an infected person and ingests those gametocytes, and that allows the parasite to then reproduce inside the mosquito and continue the transmission cycle. Next up, I'm going to talk about signs and symptoms of malaria. Um, they usually begin between 1 and 4 weeks after infection, depending on the species involved. Early symptoms often resemble the flu, and they can include fever, sweating, fatigue, nausea. Now, if malaria is not treated promptly, it can become much more severe. Patients may develop severe anemia, jaundice, seizures even, and if it gets really bad, even organ failure, coma, and obviously death can occur as well. Young children, pregnant women, people with weakened immune systems, elderly patients are especially vulnerable to severe malaria, which is why early recognition and treatment are so vital. Next, I will be talking about the diagnosis of malaria. Because the symptoms of malaria resemble many other illnesses, laboratory testing is often necessary for an accurate diagnosis. The gold standard is blood smear microscopy, where a stained blood sample is examined under a microscope. This allows healthcare providers to identify the parasite, determine the species, and estimate how severe the infection is. I showed one of those microscopy blood smears earlier in the slide, if you guys remember that. Another commonly used method is the rapid diagnostic test, which is the picture here. These tests detect proteins produced by the malaria parasite, and they provide results within 15-20 minutes. So very similar to a COVID-19 test that we would take. In some specialized laboratories, PCR testing can also be used because it detects the parasite's DNA, and that provides a very accurate identification for malaria as well. And obviously, the earlier we can diagnose malaria, the better outcome for treatment. So, treatment. Once malaria has been diagnosed, treatment should begin immediately. The first line of treatment for uncomplicated malaria is artemisinin-based combination therapy, so an ACT. Um, these medications combine artemisinin with another antimalarial drug, which makes treatment more effective while reducing drug resistance. Patients with severe malaria are often treated with intravenous artesunate, and that rapidly lowers the number of parasites in the bloodstream and is often considered life-saving. Other patients may need supportive care like IV fluids, oxygen, blood transfusions, and that's if anemia develops. So in the picture here, you can see some of the medications that are common, some anti-malarial drugs that are very common to treat malaria. Prevention. Although effective treatment exists, preventing malaria remains the best strategy for reducing illness and deaths. One of the most effective prevention methods is sleeping under insecticide-treated mosquito nets. These nets both block mosquito bites and kill mosquitoes that come into contact with them. In the image, you can see a healthcare worker teaching proper use of one of these mosquito nets. Other prevention methods include using insect repellents, wearing protective clothing, spraying insecticides inside the homes. Another major advancement has been the development of malaria vaccines, and these really help protect young children living in areas where malaria is common. Also, eliminating standing water helps reduce mosquito breeding sites and lowers the risk of transmission. I would like to highlight why malaria continues to be such an important global health issue. According to the World Health Organization, there were an estimated 282 million malaria cases worldwide in 2024, and 610,000 of those resulted in death. So as progress has been made over the last few years of malaria, it still remains one of the world's leading infectious diseases. And you can see on the map here, malaria is very concentrated in sub-Saharan Africa. Approximately 95% of malaria cases and deaths occur in this region. And children under the age of 5 are the most affected group because they have not yet developed immunity against the parasite. Overall, malaria is much more than just a mosquito-borne illness. It's a preventable and treatable disease, yet it continues to affect millions of people every year. Continued research, improved access to healthcare, and effective prevention programs are essential if we hope to eliminate malaria completely as a global health threat. Some of my sources I used. Um, Thank you all for listening to my presentation, and I hope you all have a great rest of your day. Thanks.